Do you know who is at a risk for developing a prediabetes? So the first thing you should look at is your family. If your mother, your father, your siblings, that means your sisters and brothers, or even your grandparents on both sides, mother's side as well as your dad's side, if they have diabetes, that's your first risk factor, that it runs in your family. Second thing, if you're overweight, the more the weight you have, the more the fat cells. The more the fat cells, the less they're going to listen to the insulin, the more the insulin resistance. That's where that connection comes from. Third thing, if you were pregnant before and during the pregnancy, your doctor told you, you know what, your sugar has been abnormally high. So that sugar goes back normal when you deliver, everything is peachy, but your body has shown that it is definitely capable of turning into the diabetes. So that is another risk factor. Women or the girls who have PCOS or PCOD, insulin resistance. So these are your risk factors. And as a South Asian, we all are in this continent, in this country. We have already shown that we have the highest numbers of diabetics in the world. So just by living in this country, eating the food that we eat and the genes that we have, we are already at a high risk. So these are the factors which is going to mean you can have a prediabetes. If you have family history, while during the last pregnancy, if you've had a sugar issues or anybody with the PCOS or PCOD, if you have any one of these, get yourself tested. This is the phase which is your golden opportunity. This, as a doctor, is a golden opportunity because this is the only stage where I can reverse this disease. You want to turn this thing around? This is your time. This is your opportunity because this is the phase where diabetes can be absolutely reversed, But after you cross the 6.5, that means you have given that sugar enough time to do the damage. So I can make the number look good from 6.5 to below 6.5, but the damage it has done in 10 years will take a long time to heal, but not when it comes to the prediabetes because you're catching it early, you're treating it early, and you're changing your things.